النتائج الباهرة لعملية الحجامة.
After the marvelous results of cupping first appeared, there was a huge demand for it, which resulted in certain individuals exploiting this zeal for cupping for their own financial gain. And another group of people who tried to practice cupping whilst breaking its rules and distorting the art. When we realized this, we got in touch with the medical centers, hospitals and clinics all over Syria, throughout its provinces, regions, districts and villages, guided by the directions of Professor Abdul Qadir John, otherwise known as Ad-Dirani. We explained to them the rules and laws regulating cupping. Then we emphasized that breaking any of its rules could cause harmful results. There is some concern about those who pretend to know about cupping and practice it for profit, whilst fraudulent practice doesn't detract from the real worth of cupping. It's necessary to establish some controls that regulate its operation and to condemn those who practice it haphazardly. Accordingly, clear information and trusty therapists should be readily available to all.
The program being broadcasted now aims at making patients and doctors aware of the benefits of cupping. Some doctors, unfortunately, have criticized cupping, firstly due to the fact that they have no knowledge of the art and its procedures, and secondly, the fact that they draw their data from the first-hand experiences of people who were cupped by non-expert practitioners. In these latter cases, patients might have suffered inflammation or influenza resulting from drinking milk or one of its derivatives after cupping, or from performing cupping after eating. Correctly performed cupping is free of such dangers and bears no relation to these cases. Let's now discuss the simplest case, which is the infectious epidemic hepatitis. It is claimed that cupping spreads this disease. It is known, quite apart from cupping, that this disease spreads mainly as a result of unsterilized tools in surgical operations and dentistry, infection through blood transfusion or through kidney dialysis. There have, however, been no attempts to prevent dentists from practicing their work or to stop the use of dialysis machines. And quite rightly so, for these cases resulted from unsterilized equipment and not a flaw in treatment procedures themselves. The same is true for cupping. Tragic cases like the ones above are not the fault of legitimate practitioners following procedures correctly. I'd like to say to those who oppose cupping that we should not make rash judgments. Your fellows have come to the conclusion that cupping is a scientific phenomenon which deserves studying. So, it is not right to attack it knowing nothing about it. 3 years ago, about 400 doctors and researchers in the Union of Doctors indicated an interest in studying cupping. Unfortunately, those who oppose cupping generally know very little about it. All that they know is that some people who have been cupped have suffered from an inflammation of their wounds, known as bacteremia. I would say to them that it's the fault of the medical establishment in general that has left cupping in the hands of the barbers, no offence meant to barbers, who have conveyed it to people unscientifically, through unhygienic practices and without using antiseptic lancets. They have used ordinary blades and handkerchiefs instead of bandages. I can honestly say that all the cases which I supervised have been cupped by surgeons using the same tools used in surgical operations. Through the implementation of such scientific conditions, we can realistically validate the benefits of cupping. Cupping is not a replacement for conventional medicine. It complements, corresponds with, and supports its capabilities.
We should emphasize that we do not criticize other methods of treatment, but this kind of therapy is an integral step on the right path to achieving treatment without side effects. And as Pastor said, chemical medicine is a double-edged sword, for it affects the patient as it affects the disease. Cupping has no side effects, nor does it cause any damage at all.
Some people, unfortunately, have begun to change these conditions and rules and returned cupping to its previous status as a sort of trick art, practiced only by ignorant people and with an element of risk for the patients. But when the great scholar Muhammad Amin Sheikho established strict procedures and conditions for it, he proved that it isn't at all harmful. On the other hand, damage results when chemical medicines enter the body, which they benefit and harm at the same time. Cupping removes disease from the withers, the upper part of the back under the two shoulder blades, without introducing anything harmful into the body. So we can see that no harm results from applying cupping, yet harm is caused by those cuppers who do not correctly observe its laws and procedures. It is quite well known that if the dose of the medicine exceeds the proper limit, it may harm the patient, while if it is less, it will avail nothing. Similarly, if practitioners alter the conditions of cupping, as they are doing now, they may harm the patient.
Everybody knows that everyone suffers from the complications resulting from the use of chemical medicines. The West perceived such a fact and set out to conduct research and studies about alternative medicine, or what we call prophetic medicine, where the results exceed all expectations. As a result, the West began to respect such arts. We might consider cupping as one of the branches of prophetic medicine. We might also make a fair comparison between conventional medicine and alternative ones.
So, alternative medicine is an integral complement to classic medicine, the side effects of which have been noted over the years. We depend on classic medicine, but when it fails to treat the case, we resort to alternative ones. So it would be better to call them complementary medicines, as they complement the classic ones.